Hello, my name is Brajesh and from group LA21941 and my topic is growth hormone hypersecretion. So the hormones which regulate the growth are growth hormone, thyroid hormone, insulin and insulin like growth hormone factor and androgens that play important role in pubertal growth and stimulate protein synthesis in many organs. Growth hormone is also called somatotropin because it is having tropic effect, and growth hormone is 191 amino acid single chain synthesized, stored, secreted by somatotropic cell within anterior pituitary gland, and it is metabolized in liver, and it is short duration acting of 20 minutes. So growth hormone stimulate growth by hypertrophy, by hyperplasia, and increase the rate of mitosis. So during the growth, there is decreased utilization of carbohydrates for energy production, like uptake of glucose decrease, but blood glucose is increased. Decreased use of glucose for energy production is due to increased use of fatty acids for energy production. It also inhibit hexokinase enzyme, inhibit glucose uptake by muscles. Hepatic glucose output is also increased, and insulin output is also increased, that led to burnout of beta cell of pancreas. Growth hormone function indirect effect. Most of the growth occur through indirect method. Growth act as a tropic hormone acting on the liver to produce insulin like growth factor. Insulin like growth factor is also called somatomedian C, increase growth promoting activity in many tissues and cartilage with a prolonged duration of 20 hours. So here the chart how the growth hormone works, and it is the chart how the growth hormone production is stimulated through the hypothalamus by producing growth hormone releasing hormone which act on anterior pituitary and produce growth hormone, and after that growth hormone such effects for growth like proliferation, differentiation and increased metabolism. So chondrogenesis and bone growth in young stimulate chondrogenesis and stimulation of osteoblast, increase bone matrix and length of bones. In adult, linear growth is impossible. So basically the growth hormone production is controlled by negative feedback. High level of IGF-1 stimulates somatostatin, and high level of GH inhibit growth hormone releasing hormone. So factors that stimulate or inhibiting the growth hormones are like that. Factors that stimulate are hypoglycemia, protein rich diet, amino acid in blood, exercise, stress, sleep up to 8 hours, glucagon, ghrelin. Or that inhibit are hyperglycemia, increased fatty acids, excessive growth hormone feedback to inhibit its own secretion, and excessive cortisol. So here the chart given how the growth hormone secretion is controlled. It optimized at the night time. Changing the sleeping pattern also affects the growth hormone release, and it also declines as the age proceeds. So hyperpituitarism is the increased production of pituitary hormones. So first of all is the growth hormone, which secretion is increased and led to the gigantism, which is vertical growth. Growth hormone increased by acidophils of anterior pituitary before the union of epiphysis, means it is found in children. Cause is pituitary adenoma, tumor formed by pituitary gland, secrete excessive growth hormone and insulin like growth factor 1 and non-cancerous. So clinical picture is the body is rapidly growth of skeleton, high basic metabolic rates, hyperglycemia, diabetes mellitus, low gonadotropins, short life if survived till adulthood, acromegaly. How gigantism is treated? First of all, the surgery to remove the tumor. Second is the medication, bromocriptine and cabergoline, the drugs used to lower the growth hormone level. And the third is gamma knife radiosurgery. The gamma knife is a collection of highly focused radiation beam. That beam don't harm the surrounding tissue, but they are able to deliver a powerful dose of radiation at the point where they combine and hit the tumor. So the next is acromegaly, which basically affect the adults, and it is also called lateral growth. Acro means extremity as hand and feet, and megaly means large increased growth hormone by acidophils after union of epiphysis, like in adult. And closed epiphyseal plate, bone lengthening is stopped but width is increased and its progression is slow. So acromegaly's physical effect is bone thickening, protruding the lower jaw, upper jaw, supraorbital ridge and separation of teeth. Hands and feet are enlarged, bowing of spine, kyphosis. It also have cardiogenic effect or cardiac effect. Heart grow bigger in order to pump out insufficient blood. Acromegaly have its A, B, C, D, E, F. Like A for arthralgia, B for increased blood pressure, C for carpal tunnel syndrome, T for diabetes, E for enlarged organs, and F for field defect. So these are the defects related with the acromegaly, increased secretion of growth hormone. So how can we diagnose it? Diagnosis can be done by measuring the insulin-like growth factor measurement after the overnight fasting, and also by using the growth hormone suppression test. So we will measure the growth hormone quantity before taking the glucose preparation or after the glucose preparation, or imaging to find out if there any tumor in the pituitary, or if there is no tumor in the pituitary, then we will go for non-pituitary tumors. So treatment are surgery, removal of the pituitary tumor, and medication are three categories. Like one is drugs that reduce growth hormone production, second drugs to lower the hormone level, drugs that block the action of growth hormone, and the third is radiation. There are two methods: a conventional radiation therapy and stereotactic radiosurgery. So thank you for your attention.